Hi everyone, my name is Jean Campbell and I host I'm Fine podcast, which is about pain of all kinds and the kinds of pain that we keep silent about. I'm super excited to share this series that I have partnered with the Medical Research Foundation on, who are a charity that fund research into mental health and physical health and areas that are often overlooked and underfunded. I'm so excited to be speaking to some incredible researchers from universities all over the country about varying issues that so many are affected by. Today I'm speaking with Dr. Aja Murray from the University of Edinburgh about her research into ADHD, focusing on emotional regulation, anxiety, depression, trauma, and how we can navigate life better living with ADHD. If you have ADHD or know someone who does, this is a conversation for you. I'm super excited to be speaking to Dr. Aja Murray, who is a researcher and lecturer in psychology at the University of Edinburgh. Hi.
Hi, thank
How
you
are
very
you?
much. I'm good, thank you.
I'm super grateful that we're going to be having this conversation about ADHD today, which is a subject that seems to be inundated with opinions and misconceptions. So thank you so much for your willingness to do this. Should we start by just defining what ADHD actually is?
Yeah, I think that's a great place to start. So ADHD stands for Attention Deficit Hyperactivity Disorder, but I think that's quite a misnomer because it's not really about having a deficit of attention. It's much more about like differences in how people might allocate and control their attention. But it's defined basically by two different clusters of symptoms. So the first set is inattention, which is things like having difficulty with concentration, being distractible, being forgetful. And then the other cluster of symptoms is hyperactivity and impulsivity, which kind of puts two different sets of symptoms together. So there's hyperactivity, which is like being restless, having difficulty with being still for kind of extended period of time. That could be physical restlessness, but it could also be like mental restlessness. Mm-hmm. And then there's impulsivity, which is about kind of acting without thinking, behaving quite rashly sometimes.
Like reacting?
Not even necessarily reacting, but just kind of doing something quite impulsive. Often it is reacting, and often it's quite kind of like emotionally driven. It's like in response to like feeling big feelings.
Is emotional dysregulation, is that a symptom of ADHD, or is that just a common theme that you see in people with ADHD?
The kind of defining features of ADHD, the things that qualify people for a diagnosis basically are like inattention, hyperactivity, impulsivity. Mm-hmm. But there's various other features that are associated with ADHD. So emotion dysregulation, which would be characterized by kind of having like, you know, big feelings, having difficulty coming down after you've had an emotional response to something, having really big emotional reactions to things. Mm-hmm. That's something that affects actually most people with ADHD.
It's not in the diagnosis.
It's not, yeah, so it's kind of like an associated feature. I think the main reason is that it's not specific to ADHD. Mm-hmm. So you see emotion dysregulation across various different kind of mental health issues. You see it in like depression, anxiety. Just
to go back a little bit, when it comes to the attention part, obviously attention is quite it's quite a vague idea in a way. So how would you be able to decipher someone who's kind of restless and anxious, say, who doesn't have ADHD versus someone who's got a deficit in attention as a result of ADHD?
That's a really good question, because you can often see that anxiety will affect people's attention. Like if you're worried about something, it's obviously quite difficult to concentrate on stuff.
Distracted.
So exactly, yeah. I think like many people can relate to that idea. So when it comes to diagnosing ADHD, there's a need to kind of look for more ADHD specific symptoms and looking at whether anxiety is a better explanation for that and looking to see whether there's other symptoms associated with anxiety. The thing is though, anxiety really commonly co-occurs with ADHD as well. It's quite hard to have ADHD.
Yeah, presumably it's anxiety inducing to not be able to focus or to be restless when you're meant to be being present for whatever it is that you're doing.
So they very commonly happen together. Often, so ADHD is quite underdiagnosed in women, and often like actually the first presentation in women is more like anxiety or depression. And then on further investigation, it's discovered actually the anxiety or depression is more caused by an underlying ADHD. And that's actually the root
so
cause.
Interesting.
So they're very, very closely connected.
Is there a sort of figure that you could give in a way to people who have anxiety and depression as a result of ADHD, or depression and anxiety that looks like ADHD?
We definitely know that people with ADHD have higher levels of anxiety and depression than people who don't have ADHD. So I think it's maybe about 30% would qualify for a clinical diagnosis of anxiety who have
That's huge.
ADHD. But it's difficult to get quite precise numbers because, like, we know, for example, that in women ADHD and anxiety might look quite similar. Is it ADHD? Is it anxiety? Are they co-occurring? That kind of thing. It can be difficult to sort of tease apart.
So where does ADHD actually come from? Is it something that we sort of develop through our childhood or adolescence, or is it something that you're genetically predispositioned to?
So there's a very strong component to ADHD, meaning that it's very much influenced by genes. But that doesn't mean that it can't be shaped by other influences, like environmental influences. There's some evidence pointing to things that happen prenatally having an influence on ADHD symptom development as well.
What kind of things would those be?
So things like paracetamol use during pregnancy.
Okay.
We have to take these results with a little bit of a pinch of salt because it's very difficult to actually attribute causality. Like it's
But these are
difficult to,
just
these are
it's
associations.
the world of research.
Yeah, it's probably uncontroversial to say that it's possible that there is stuff that happens prenatally that kind of programs prenatally that would predispose ADHD. And then there's all sorts of things around family environment that might influence ADHD symptoms and the impact of those symptoms. So one sort of complicating factor is that because it's quite genetic, children with ADHD will often have at least one parent with ADHD as well. And the way that ADHD symptoms might develop are influenced by, like, for example, whether you have a kind of supportive family environment that's stable, where parenting is kind of warm, sensitive, supportive. This can be a real positive in terms of ADHD symptoms and like the associated features like emotion regulation. On the other hand, not having that stable, supportive environment can be a negative for their development.
At that point, I guess it brings up the question, is it learnt behaviour? So are you behaving the same way that you have seen a parent behave who has ADHD and you've kind of developed the qualities of it? Or is it that it almost activates your own ADHD?
And so it's definitely seen as something that's more kind of inborn in a sense, in that predisposition will come and kind of be present from early in life, and you'll start to see symptoms early in life. But that doesn't mean that kind of observing behaviour won't maybe kind of reinforce those symptoms, or that the way that children interact with their parents might lead them to develop more or less symptoms and kind of associated features. Like, I always think like emotion socialization is a really good example. So as I mentioned, people with ADHD tend to have difficulties with emotion regulation. But if they have parents who show healthy ways of dealing with emotions, if they react in a kind of sensitive, supportive way when their child expresses emotions, if they have good conversations about emotions and what emotions mean and kind of help them develop that emotional literacy, that can really help mitigate those challenges that young people with ADHD might have with emotion regulation otherwise. So I think that's a good example where like a kind of predisposition towards like having difficulties with emotion regulation can be massively mitigated by the way that somebody is brought up and those that relationship with their parents.
So there
as
are
well.
ways that it could be better or worse, essentially.
Yeah, definitely.
But it wouldn't
yeah.
stop you from, it's not something that you sort of develop, essentially.
I would say it's mainly, I think by definition it's kind of more like an inborn thing.
Going back to the childhood point, symptoms of trauma could present in a similar way to the symptoms, so some of the symptoms of ADHD. How do you differentiate between someone who is presenting symptoms of trauma and someone who has ADHD?
Yeah.
And are those two interlinked? Is the person who has ADHD more likely to experience trauma?
It's a pretty complicated relationship between ADHD and trauma. So people with ADHD are more likely to experience trauma, but also if you...
Why would that be?
People with ADHD are more likely to engage in kind of risky behaviour, so they might be more exposed to traumatic events. As children, they might be more likely to have a parent with ADHD, which might sort of increase the risk of exposure to other kind of difficult conditions as well. But what's also interesting is that for people who experience trauma, those who have ADHD are more likely to develop a trauma-related disorder like PTSD. So not everybody who experiences trauma will go on to develop something like PTSD, but those who have ADHD are more likely to. So it seems like there's a few different things going on there. And then there's, as you mentioned, the fact that people who've experienced trauma will often show symptoms that look a lot like ADHD. So like difficulties with concentrating, maybe seeming kind of like zoned out at times, showing impulsive behaviour. So ideally what a clinician will want to do is to look at those symptoms and try to decide, are they better explained by trauma or by ADHD? And there's a few different kind of things you can look at. Like for example, ADHD is neurodevelopmental in nature, and so you'd expect to start to see some symptoms pretty early in life, even if it's not like kind of clinically impairing yet, you'll still start to see the early signs. Whereas trauma symptoms will very much be precipitated by a traumatic event. Exactly.
It's important to kind of like check in with the person who may be listening, who has ADHD, because some of the takeaways are, you know, possibly that you're more susceptible to challenging things in life, or that there's a greater sensitivity and you're more susceptible to something like PTSD, which could be internalized as weakness or like hypersensitivity. How would you, and obviously ADHD, I mean, I would like to think it's not something that's, you know, wholly negative, and something that can be managed. But how would you kind of speak to the person who may be feeling like they're weak because they're more likely to go through traumatic things because of their impulsivity, but that also doesn't mean that they welcome it,
Of course, yeah.
you know, or why would they get PTSD and someone else who doesn't have ADHD may not get PTSD? Or maybe both of them would, you know.
I kind of think of it the other way around. I think for people with ADHD, they have to be so much more resilient because so many things are kind of so much harder to do, and they have to work so much harder to kind of, you know, like get through school and kind of function at work, function in relationships. So I actually very much see it the other way around, that people with ADHD tend to be very resilient given all of the challenges that they have to overcome that that people who don't have ADHD have to do to a less extent. And I think what's quite, again, not to kind of minimise the challenges of ADHD, but I think what is quite positive is that there's much more interest now, more research on what are the strengths associated with ADHD as well.
Can we talk about some of the strengths of
I love talking about the strengths, yeah. So it's an area that's still in its infancy because there has been a lot more focus on kind of what the difficulties, and I do think that is obviously really important as well because we need to know how can we help support people through those difficulties. But there's research suggesting that having ADHD might be associated with qualities like creativity, with warmth, with having good kind of entrepreneurial traits. I mentioned before as well, hyperfocus, the ability to kind of like really focus down on something that's of interest to you, which can be really valuable when kind of leveraged in the right way.
Yeah.
And I think what's interesting is I think employers are starting to catch on to this as well. So they're now seeing it not as just like a case of how do we kind of better accommodate people with ADHD in the workplace, but how do we kind of recognise and actually leverage those strengths as well, to kind of promote the success of the employees, the company, etc. So I think it's something we'll see a lot more of in the coming years as well.
Going back to the kind of emotional regulation aspect, how would you, based on your research and your experience, How would you kind of guide someone to finding a way of manageability with ADHD and emotional regulation?
Yeah, I think there's a whole range of different kind of emotion regulation skills that people can learn and practice, and it kind of helps them to become a habit. So we regulate our emotions in different ways, and some of those ways are more adaptive than others. So for example, if we experience something that makes us sad or angry, there are various different ways in which we might respond to that. One way would be to try to suppress that emotion or try to avoid that emotion. But actually, paradoxically, that tends to make it worse. People who tend to do that a lot tend to be more likely to have like anxiety and depression. Maybe we ruminate, like maybe we just kind of turn something over in our minds over and over again, but we don't kind of try to solve the problem, we just make ourselves feel worse. On the other hand, there's techniques that are thought of as a bit more adaptive, like cognitive restructuring is one example, which is where we try to think about a situation a bit differently. Like rather than focusing on the negative, we think about, well, what can I learn from this situation? Or maybe it's not quite as bad as I initially thought. And I think something else that's really important is like acceptance of emotions, like letting yourself just feel them in a kind of non-judgmental way. But there's a whole load of kind of like other emotion regulation strategies out there. I think the first step is to kind of have some awareness of what these strategies might be, reflect on what strategies am I using, am I using the most adaptive strategies, and kind of building up that repertoire of more adaptive strategies, practice using them. And importantly, also kind of like being flexible about how we use them, because there's not going to be like one strategy that makes sense for every situation. And actually, even the like sort of maladaptive ones are sometimes adaptive in certain specific situations. Like let's say you're at like a really solemn event and you think of something funny, you really want to laugh, it's probably not the best idea to kind of express that emotion right in that moment. It's better to probably suppress it for the time being. So I think just having that ability to use all the different strategies, be aware of them, then as the situation demands, you can deploy the strategy that is kind of adaptive in that situation.
And also something that we talked about previously that we haven't yet touched on is that the presentation of each individual's ADHD can be different.
Yeah, absolutely.
And so it's not to say every single person with ADHD has every single symptom.
Yeah.
Everyone is different,
Yeah.
right? And these are just kind of themes that appear. So would you say that there's something to be said for kind of actually having acceptance around your situation, and that actually there isn't something wrong with you? It's just about learning how to manage it and live with it and embrace actually who you are.
Definitely. And I think one of the reasons why having a diagnosis can help people a lot is because it gives them like a framework for understanding themselves. But I think your point is really important. Like ADHD is not the same for everyone. It's kind of one of these things where two people could have an ADHD diagnosis and have like no symptoms in common at all. It could be completely different. And not just the symptoms, but the way that those symptoms affect you as well can be really different. So I think kind of knowing that you have ADHD is a good starting point for learning more about ADHD and the particular ways in which it manifests for you and affects you. And that can help with kind of understanding, okay, how do I manage this and potentially even leverage this as well as a strength.
Can we talk about some of the co-occurring conditions with ADHD and also links to pain?
I don't know if like many people would immediately see a strong link between ADHD and pain. They might be wondering kind of like, why would you talk about pain in the context of ADHD? But actually, we know that people with ADHD are much more likely to experience pain. And actually more than that, for people who experience pain, if you have ADHD, your pain interference is higher. So that means that it affects you, it affects your functioning, it affects your quality of life to a greater extent. And so there's definitely like a strong link between ADHD and pain. There's some kind of biological elements to it. So one possible explanation is that people with ADHD and people with chronic pain both have higher levels of inflammation within the nervous system. So that might be a common factor between the two.
And your nervous system is the thing that kind of regulates pain.
Yeah, exactly. There's also been proposed to be a kind of motor regulation component to it as well, so that the way that the brain regulates what we do with our muscles, in ADHD, the brain is kind of telling the muscles to maintain a kind of persistently high muscle tone, which means that the muscles get kind of fatigued and uncomfortable and painful. And actually, some people have proposed that this might partly explain the physical restlessness of ADHD. Essentially, people are feeling kind
Ready
of in
to
pain.
go all the time.
Yeah, and they're kind of moving around to try and get some relief from that pain. So that's a really interesting idea. There's also kind of psychological components to it as well, because how we experience pain is very much related to attention. And for people with ADHD, they might have more difficulties with disengaging their attention from pain. There's also evidence actually that people with ADHD have greater pain sensitivity, so they're actually feeling the pain to a greater extent. It's like more painful for them.
Why is that?
We don't really know. It might be to do with the attention. Like, it might be more difficult to disengage your attention from the pain, so you're experiencing it, like your subjective experience of it is greater. It might be to do with greater sensitivity to do with the inflammation that we were talking about. I think all of these things are kind of like connected and kind of all play a role.
But it's also interesting because I suppose then you could say that, you know, there are people who have long-term pain, or there are people who go through painful experiences who build resilience, and they may happen to have ADHD, and maybe they end up with a higher pain tolerance than the person who doesn't have it.
Yeah,
so
because of their experiences.
it's not binary, is it?
Not at all, not at all. And I think it's another example where people with ADHD are more likely to experience like injuries and accidents as well. So they are experiencing more situations where they're more at risk of developing kind of chronic pain and stuff like that too. So yeah, there's lots of different ways in which pain and ADHD are related to one another. Yeah,
super interesting. And so just in terms of solutions, you know, I think by no means is this does this need to be like a life sentence,
of course not.
even though it's not something that I gather you grow out of. But how would you say that, obviously there's medication, but how would you say that someone with ADHD can use their kind of lifestyle to manage their ADHD and possibly use that management as a means of transformation even?
One of the positive things about ADHD is that with medication and with therapy, people often do very well, but actually medication, for example, doesn't work for everybody. Not everybody wants to take medication. So there's an important role for other kind of elements as well, ADHD therapies, but also lifestyle factors can play a role as well. So maintaining good sleep, physical activity in particular has been shown to be beneficial for like the cognitive symptoms of ADHD. So
what kind of, is there any sort of specific kinds of exercise? Is it higher impact or lower impact?
Generally, kind of moderate to vigorous activity. But I think we have a bit more to learn about exactly like what kind of dosage and what. But like, you know, like physical activity is just good for you in general as well. So like it's never a bad thing to engage in more physical activity. And although we don't know the specifics exactly about what's the right dose and things like that, I think it's safe to say.
But you see people having their lives improve as a result of, you know, changing their sleep hygiene or engaging in a kind of exercise routine. How about diet?
Diet, yeah. So diet also, so there's some evidence that suggests that particular dietary interventions can be beneficial for ADHD. Again, I would say it's an area where we probably need a bit more research, and it doesn't seem to be the case that it's quite a match for kind of like your primary treatments for ADHD, like medication and therapies for ADHD, but it's contributing to living well with ADHD, definitely.
What about your environment? Are there things that the person suffering with ADHD can do in their own environment to kind of empower themselves living with ADHD?
Learning various different skills can be helpful for ADHD. Particularly, I mean things like skills for dealing with stress, skills for emotion regulation. We talked a little bit about kind of getting to know yourself and using ADHD as a framework for understanding yourself and for figuring out what works for you, how you might want to shape your environment to kind of better suit your characteristics. I think these are all important, and I think, you know, the nice thing is that although ADHD can be associated with quite a lot of difficulties. Treating and managing symptoms really alleviates those difficulties. So we talked about, like, for example, anxiety and depression and things like that. But actually successfully treating the symptoms and managing the symptoms can have a positive impact on those co-occurring conditions as well.
So can we talk about the diagnosis rates and differences between men and women and the reasons behind that?
More men get diagnosed with ADHD than women, although the gap is slightly kind of narrows in adulthood. So it's like the difference between men and women is smaller in terms of diagnosis rates in adulthood. And there is some evidence that women might be more likely to be missed or to be kind of diagnosed later. And there's probably a few different reasons for that. One is societal, I guess, that ADHD is kind of traditionally been thought of as something that affects boys, and especially kind of younger boys.
Is that because it's sort of quite typical for young boys to be like running around and like
It's kind of seen as like more sort of like stereotypically male, and that was kind of reflected in the diagnostic criteria, that they didn't really capture like how it might affect women. So women tend to experience more of the inattention symptoms relative to the hyperactivity, impulsivity symptoms. And if they're experiencing hyperactivity, it might be more internalized, so it's more like a kind of mental restlessness as opposed to physically
like
restless.
overthinking.
Exactly. The other thing that is a factor is that there's often what's called diagnostic overshadowing. So women might experience anxiety and depression at higher rates, and that can kind of mask ADHD. So they might not be getting a diagnosis of ADHD because they're getting a diagnosis of anxiety or depression. In some cases, that initial investigation into anxiety or depression will lead down the road of ADHD, and they will get that diagnosis. But sometimes it is like the ADHD might be missed because the anxiety or depression is kind of more prominent or kind of like masking it.
How would you say that that can impact the lives of women where they're not getting diagnosed till later, or maybe, you know, people don't recognise what they're experiencing?
Yeah, I think it can make it quite challenging, because I think having a diagnosis can kind of open up a lot of opportunities to kind of learn about yourself and to kind of understand ADHD, and even just at a basic level to recognise like where you've been struggling, that that's not like a failing, or, you know, I'm not like weak or whatever.
Yeah, it's not like in your head.
Exactly, yeah. So there's that kind of validation, and then there's also that kind of starting point for learning more about it and access to interventions and just understanding it. You can kind of adapt your life in certain ways that make it easier to manage and things like that. So basically, if you're not having ADHD recognised, if you're not getting a diagnosis, you don't have those opportunities that you would have if you
and the
did have it recognised.
resources.
Exactly, yeah. And then there's the point you made about how other people are perceiving you as well, and if there isn't like an explanation for the things that you find challenging, then there might be a risk that people are seeing you as like being difficult or lazy or something like that, which is really unfortunate. Whereas when it's possible to say, okay, this is ADHD, people can be more kind of have more empathy in a sense, because they can link it to something like concrete that they can kind of understand. So I think, again, like not having that recognised can add all of these challenges, because you don't know what it is, but other people also don't know what it is that you're facing.
Well, also another thing that you mentioned being, you know, something that you notice in people who live with ADHD is burnout. Having to make up the difference between yourself as someone with ADHD and the neurotypical person and trying to basically fit in.
Yeah, absolutely.
Is probably really exhausting.
Absolutely, yeah. So, I mean, on the surface, you might actually sometimes see that people with ADHD seem to be functioning like totally fine, but like the level of effort that kind of goes into that behind the scenes, they're kind of working much harder.
It's like a swan with their legs under the water.
Exactly, yeah, that's a really good analogy for it, exactly. And then there's also the masking as well, because people might feel like they need to fit in and they need to behave in a certain way. So they're putting all of this effort into putting on this kind of like certain social behaviour that might not be natural to them, and so that's really exhausting as well. So I think that it can be more common for women as well.
Yeah. Do you see negative coping mechanisms appearing when it comes to masking ADHD, or things that people lean into that are maybe unhealthy or, not helpful in their life?
There can be, people might develop kind of maladaptive ways of coping with not just ADHD, but the fact that when you have ADHD, you might be more likely to experience negative emotions and difficulties with managing emotions. So you might get into kind of like maladaptive emotion regulation strategies. You might start avoiding situations that are difficult, and sort of develop this kind of negative cycle of avoidance, basically. We talked a little bit about how people are more likely to kind of develop anxiety and stress in relation to ADHD because of those additional difficulties. So I think for people who aren't recognised as having ADHD, there is maybe a bit more of a risk of experiencing these kind of like co-occurring issues, or having more maladaptive coping mechanisms as compared to where it's recognised and they get support and they kind of learn more adaptive ways of dealing with ADHD symptoms.
So there's so much to be said for being diagnosed and understanding what it is that you are having to manage and live with. But then at the same time, do you think that there is a level to which having acceptance for yourself and not seeing it necessarily as like a disorder or a sort of largely negative quality to have?
Yeah, I think it's also important to recognise that it's not actually easy to get a diagnosis for many people. Like, there are waiting lists, it's not equally accessible for everybody. So even for people who feel that they would meet diagnostic criteria for ADHD, they may not actually very easily receive that diagnosis. Even when they want to be diagnosed, it's not that easy. And then I think there's the point about, is it potentially overly pathologizing ADHD? I think that is also potentially a consideration and potentially a risk that it focuses too much on the negative. I think that the key thing is that people get the support that they need. And diagnosis is a way of opening that up, but it's not the only way. And many people legitimately decide, I don't want to pursue a diagnosis for ADHD. They might feel that they have ADHD. They might kind of self-identify as having ADHD, but they just say, well, actually, having a diagnosis isn't necessarily going to be that helpful for me.
Whereas for others, it may be very helpful.
Exactly. So it's very individual. And
yeah.
I don't think it's the case that like we should say that everybody who could meet diagnosis for ADHD should necessarily get that diagnosis. It might not be right for everybody.
So just as we kind of like wrap things up, do you think that there's a world in which we can say that there is actually opportunity in having ADHD and it doesn't necessarily need to be a negative thing in your life? You don't necessarily need to think of it as being negative, but in fact there are possibilities that are there.
I definitely think so. Again, I think we need to be careful because I think there's sometimes a narrative around ADHD as a superpower, which I think people might find kind of patronising, and it might not tally with their experience because they might feel like, oh, I'm actually really struggling. Like, this doesn't feel like a superpower at all. This feels like a real impediment. On the other hand, I do think there can be strengths associated with ADHD, like some of the things that we talked about before, like the ability to hyperfocus, that kind of energy that it can bring, the passion that it can bring, and things like that. So I think it's good to have a kind of balanced perspective of like, you know, being kind to yourself and acknowledging that things often will be more difficult for you, and like that's okay, and like that's not like a failing, that is just
a weakness.
Or a weakness, exactly, yeah. But it's, you know, it's important to acknowledge that as well.
Yeah,
like
100%.
Yeah, but also seeing like, well, actually there are some strengths and opportunities associated with having these characteristics that can really make people special and stand out. And it's not a surprise, I think, that we see many kind of like real successful people with ADHD, like sports stars and entertainers and entrepreneurs and stuff like that, because those same characteristics, when kind of harnessed in the right way, can be this like big strength and opportunity for people as well.
Amazing. And if you were to give one piece of advice to someone who kind of doesn't really know what to do with their situation, what would that be?
I think I would suggest to kind of educate yourself about ADHD, find out about it. Being very careful about the sources though, because there's a lot of information out there about ADHD that just can't be trusted. There's been studies suggesting that like a lot of stuff on like TikTok, for example, is like actively unhelpful and false. So I think going to some good sources, learning about ADHD, thinking about what that might mean for you. And this is, you know, also kind of to say as well, people can seek support and diagnosis and things like that as well. But I think there's also a lot that people can do to kind of just learn more about it.
Amazing. And so those resources will be in the show notes for anyone who wants to kind of learn about ADHD. Asia, thank you so much. It's been such a privilege to get to speak to you, and I really hope that anyone listening, it's been helpful to hear Asia's research and experience. Thank you.
Thank you very much.